Do men and women experience ankylosing spondylitis the same way? Not even close. And understanding the differences can be the key to getting the right diagnosis and treatment. Hello, this is Dr. Siddharth Damber from Chicago Arthritis and Regenerative Medicine. I specialize in non-surgical treatments for musculoskeletal conditions, rheumatology, regenerative medicine, and metabolic health. My goal is to help you live pain-free and optimize your health with cutting-edge treatments. Today, we're talking about a form of inflammatory arthritis called ankylosing spondylitis, or AS for short, and how it shows up differently in men and women. Why is this important? Because women are often misdiagnosed or diagnosed late, which can delay effective treatment. So let's dive into why that happens and what we can do about it. What is ankylosing spondylitis? AS is a type of inflammatory arthritis that mainly affects the spine and sacroiliac joints. It's part of a larger family of conditions called spondyloarthropathies. In AS, the immune system becomes overactive and starts attacking the joints in the spine, causing pain, stiffness, and eventually, in some cases, fusion of the vertebrae. It's a chronic condition, but the earlier we catch it, the more we can do to manage it well. The most well-known signs of AS are chronic lower back pain, especially in younger people under the age of 40, morning stiffness for more than 60 minutes that improves with movement, pain that wakes you up at night or early morning, improvement with exercise, but not with rest. But these classic symptoms don't always show up the same way in women, and that's part of the problem. Historically, most research and diagnostic criteria were based on how AS presents in men. Here's what that often looks like. Clear inflammation on imaging, especially in the sacroiliac joints. Faster progression of spinal fusion. Higher levels of a blood marker called C-reactive protein. A higher rate of being HLA-B27 positive, a genetic marker associated with ankylosing spondylitis. Men tend to have more obvious structural damage on imaging, which makes diagnosis more straightforward with standard tools like X-rays and MRIs. Women with AS tend to have a different experience. Here's what we commonly see. More widespread pain, not just in the lower back. Pain in areas like the neck, shoulders, or hips, sometimes even the heels. Less visible inflammation on imaging early in the disease. Often lower CRP levels, making labs look quote-unquote normal. More fatigue, more pain, but less structural joint damage. More likely to be misdiagnosed with fibromyalgia or mechanical or wear and tear lower back pain. This makes it harder to catch early unless you know what to look for. So why are women often misdiagnosed here? There are a few big reasons. The diseases look less dramatic on X-rays in women, especially early on. They may not have as high inflammatory markers, and their symptoms don't follow the exact same textbook pattern. Pain is a bit more widespread, which overlaps with conditions like fibromyalgia. Our healthcare system still relies heavily on traditional imaging and lab work rather than nuanced clinical judgment. It frequently takes a trained eye and the right tools, like diagnostic musculoskeletal ultrasound and MRI, to pick up on subtle inflammation that's often missed. One of the tools that I use in my practice is diagnostic musculoskeletal ultrasound. It allows me to see subtle joint and tendon inflammation that doesn't show up on X-rays or even early MRIs. In women who have more diffuse symptoms or normal labs, ultrasound can be a game changer here. It gives us objective evidence of inflammation and helps avoid months or even years of misdiagnosis. Here's what's interesting. Once AS is properly diagnosed, treatment should be based on the severity of inflammation, not just gender. But because women often experience more pain and fatigue and less structural damage, their treatment may need to address not just inflammation, but also nerve sensitization, fatigue, and sleep issues. In my clinic, treatment often starts with basics like physical therapy and mobility work, anti-inflammatory nutrition, supplements like omega-3 and curcumin, and then if needed, biologic medications to control inflammation more significant. And when appropriate, regenerative options like platelet-rich plasma or PRP or alpha-2 macroglobulin to reduce local joint inflammation as well. Let me give you a real example. A 34-year-old woman came to me with chronic neck pain, fatigue, and intermittent hip pain. She'd been told she had fibromyalgia and was given muscle relaxers. Her labs were mostly normal, but her story, pain worse in the morning, better with movement, trouble sleeping, was classic for inflammatory arthritis. Her examination fit better with inflammatory arthritis rather than fibromyalgia. Her ultrasound showed mild fluid or an effusion in her hips and sacroiliac joints. We treated her early with anti-inflammatory strategies, physical therapy, and eventually biologic medication. Within 6 months, her function improved dramatically, her pain improved dramatically, and she's doing very well. On the flip side, I saw a 28-year-old man who had classic AS, back stiffness, high CRP, and sacroiliac joint inflammation on MRI. Diagnosis was more straightforward. He was started on biologic quickly as well and showed improvement within a couple months. Same disease, 2 different journeys, 2 diagnoses. Some key takeaways. Ankylosing spondylitis can present differently in men and women. Women often have less imaging evidence early on and more diffuse symptoms. Diagnosis typically requires careful listening, clinical judgment, and often advanced imaging. Early treatment is key to prevent damage and improve quality of life long term. Personalized treatment matters. No one-size-fits-all approach here. If you or someone you know has back pain that doesn't improve with rest, especially if you're young and active, don't ignore it. Men and women may present differently with ankylosing spondylitis, but both deserve early, thoughtful care. AS does not have to limit your life. With the right strategy, you can stay active, pain-free, and thriving. If you found this helpful, make sure to like and subscribe. Also, check out our website at chicagoarthritis.com for more expert advice on staying pain-free and healthy. If interested in a consultation, contact us for an appointment. Thank you for watching. See you next time, and live well.